Hey everybody, this is Andrew Lee, the health insurance guy, and I just wanted to make a quick video about something I get pretty much every day when I'm at the office here. So I'm gonna go over 5 things that I always get questions about. So the number one is, what is the difference between Medicare and the Affordable Care Act plan, right? So Medicare is a federal health insurance program, primarily, geared towards people 65 and older, so seniors, and also people under 65 with disabilities that have had, maybe disability for 2 years. Then they're going to be eligible for Medicare, and it's going to comprise of different parts. Part A, which is going to be hospital insurance. Part B, which is medical insurance or doctor insurance, that's going to equal your original Medicare. Okay. Now, the Affordable Care Act plan, or ACA, Obamacare, um, that's going to be state-based exchange health insurance through the marketplace, or somewhere where individuals and families can shop. If you're not offered insurance through work, if you're self-employed, if you're offered COBRA as a severance, then this is the plan that you want to enroll into. Also, there's going to be Medicaid determinations, within a marketplace application. If you make too little money, if you're in a bracket, low income bracket, then the county's going to provide essentially free health insurance for you. It's called Medicaid. So the big difference between Medicaid and Medicare. And I also get question number 2: can I have both Medicare and an Affordable Care Act plan? Answer is generally no. In most cases, individuals eligible for Medicare are not eligible to purchase a plan through the marketplace because, one, the marketplace is subsidizing your policy already, and Medicare already generally provides comprehensive coverage. And one of the knockout questions on the ACA policies or application, one of the knockout questions are, do you have Medicare's Part A and B, right? So if you say yes, then you're already out. But if you said no and you decided to go on an ACA plan and have Medicare at the same time, guess what? You're gonna start owing back some subsidies because you can't have two major medical plans at the same time that are essentially subsidized. Depending on if you go with the Medicare Advantage plan, those are generally $0. So just watch out for that. You just, rule of thumb, can't have both at the same time. The third question I always get is, how do I qualify for Medicare? Right? So generally, people qualify for Medicare if they're 65 and older, to work 10 years or 40 quarters, whatever the equivalence is. And, they're going to be eligible for Medicare because they've already paid into their FICA taxes this whole time, just like how I've been doing right now. So if you've already paid up, then Medicare Part A kicks in, and then Part B you just have to apply for. And again, these are going to be for people who are 65 and older, or people who have certain, disabilities. Now, another question that I get, question number 4, is, what type of coverage is going to be available to me with Affordable Care Act plans, right? So Affordable Care Act plans, they're going to offer basically privatized health insurance. So it's very much going to look like the health insurance that you think health insurance is. So it's going to have, doctor visits, hospitalization, prescriptions, x-rays, diagnostic imaging, pregnancy, you name it, right? You name it, it's going to be built like a regular health insurance plan. That's basically what that is. And what happens is, with the Affordable Care Act, based off of your income, your household size, your zip code, and your age, and the ages of everybody in your taxable household, you do get a subsidy based off of that, right? So if you're deserving of a subsidy, why not take it? And question number 5 I always get is, how can I apply for Medicare or apply for an ACA policy, right? Medicare generally, usually when you become 65 and you're receiving Social Security benefits, Part A generally kicks in, Part B, generally they're going to take that premium out of, your premium out of the Social Security benefits. And you can apply online, you can apply through the Social Security office, going directly in there, or calling 1-800-Medicare. But I would say grab a lemonade, a tea, or a wine. It's going to take a little bit to get somebody online. You know how the county does. You know how, you know, social workers and all that good stuff works. So just giving you a fair assessment of how long you'd probably have to wait. Now, with Cover California, you can enroll during the annual enrollment period. You can enroll, directly through, the state exchange, like I mentioned, or through ACA, the marketplace, the federal marketplace is healthcare.gov. You can apply um, for your plan through there. Of course, I would recommend always reaching out to a broker, an agent like me. A broker meaning we have multiple carriers. We're not married to the one. We're not just giving you one option. We have everything, right? We have all of the carriers. So if you don't know how all this works and you're lost, it literally takes about 3 minutes to really get, an idea of what you're actually needing out of your policy, and then the rest of the time customizing it slowly and slowly so that you have the plan that you want come the upcoming year if you're in open enrollment, or come the next month if you're in a special enrollment. And of course, with ACA, you can apply, with the special enrollment period if you have one of those. Again, just whatever the case is, you can apply online or over the phone or reach out to an agent. Now, once you turn 65 and you're on Medicare, for example, then you're going to need a Medicare health plan, either a Medicare Advantage or a Medicare supplement. And that's where us agents and brokers come in again, because why do this alone? You can have somebody on your team looking at the same screen together and, giving you our expertise. I've been doing this for 10 years now, so there's something I know, right? So, of course, these plans and these systems can change, but that's just what's in place right now. So I just wanted to make a quick video about some questions that I get. And thanks for tuning in. If you have any questions or if you need assistance with enrolling with either ACA or Medicare, feel free to give me a call. 323-306-2129. I swear I'll answer. I'll see you guys at the next video. Thank you.